By the time a man reaches 70, probably 70 to 75% of men have hair loss. And a lot of them don't know that there was something they could have done about it. Take control now. You don't have to sit idly by and watch your hairline move further and further back. Did you know you can do something about your hairline? In this video, I'm going to talk to you about how you can battle your receding hairline, and as a matter of fact, battle hair loss in general. So what is a receding hairline? Well, that's when you start to notice that your hairline that used to be here when you were a teenager is now here when you're an adult. That's from the impact of male pattern loss, genetics on your follicle, and the hair follicle sensitivity to dihydrotestosterone. It's a normal part of aging, but when it goes too far, that's male pattern loss. If you notice that your hairline is thinning or starting to move back, that's an early sign of male pattern loss. Early intervention is the key to this. Those follicles are sensitive to a hormone in your body called dihydrotestosterone, and it's really important to address that. The way you address that is first recognizing the condition and then treating it properly. Male pattern loss never stops, so if you start to notice that your hairline is receding, it's better to get treatment earlier than later. So once you feel that you have male pattern loss or receding hairline or thinning hair, it's really important to seek professional help. I would seek a specialist in hair restoration and hair loss and get a proper diagnosis. They'll ask you questions about what you've noticed, how much it's receded, if there's a family history, medications that you might be on, such as testosterone, and they'll talk to you about your condition, make a diagnosis, and recommend the proper treatment protocol for you. Let's talk a little bit about the medical treatments themselves. If you've been diagnosed with male pattern loss, your specialist is going to make some recommendations for medical therapy. Now, medical therapy in general can slow the hair loss process and improve the quality of the hair that you do have. Now, we don't have a treatment that's 100% successful. In other words, male pattern loss is not something that's curable. You will always have this condition, but the medications can slow it down significantly. What are these treatments? Let's talk about them. First one I'll mention is Finasteride. Finasteride is a medication that blocks the conversion of testosterone, a normal hormone in the male body, to something called dihydrotestosterone. And the one we're mostly concerned about right now is dihydrotestosterone type 2. That's been linked with male pattern loss. So this treatment, when taken orally or topically, can block the conversion of testosterone to dihydrotestosterone type 2, DHT type 2, and slow down the hair loss process. There's another medication, this has been out for many years, over 30 years, and that is Minoxidil. Minoxidil is a medication that can be taken orally or applied topically to do the same thing that Finasteride does, and that is slow male pattern loss or improve the quality of the hair you have. Minoxidil works in a different fashion. We don't exactly know what it does, but we think it has something to do with potassium channels, maybe allowing the energy carrier in the cells called ATP to go into the cells much more readily. We're not sure, and that's never been worked out, but we do know it works, and I would encourage you to consider that. Minoxidil is available over the counter. That means you can go to a pharmacy or a grocery store, pick this up, and start it as soon as possible. Another treatment that we have is PRP, or platelet-rich plasma. We know platelets that are in your body that help you clot when you cut yourself also contains little packets of growth factors. And some of these growth factors can actually impact your hair. So when your follicle that's subject to male pattern loss is exposed to these growth factors, it can actually reverse the process to some degree. This treatment involves going into a doctor's office. They draw some blood, spin it down in a special centrifuge to separate the plasma from the other blood components. They then take this plasma, inject it into your scalp, and then activate it so the platelets release those growth factors. This treatment has been shown to be very successful, maybe not quite to the same degree as Finasteride. It's around the same efficacy as Minoxidil. The next treatment I want to talk about is something called Photobiomodulation, or some people call it low-level laser light therapy. And basically what this involves is wearing a hat or helmet that has these laser devices embedded in the top of them. The way these work is you expose your scalp to these laser lights in a range of these frequencies. It's a low-level laser, so it's not heating your scalp and it's not causing any skin damage. But what it's doing is going into the depths of the skin to a small degree and stimulating the mitochondria, the powerhouses, or the power units of the cells, and increasing the protein production and the metabolic rates of the follicles to improve the quality of your hair. It's my opinion that if you have male pattern loss, you should consider doing all of these therapies. Why is that? Isn't it expensive? It involves a little extra time, but basically all of these are attacking the hair loss issue at a different site. In other words, the Finasteride is blocking the conversion and the production of DHT type 2. Minoxidil is allowing more power energy units into the cells. The PRP is adding growth factors. The low-level laser light is actually stimulating the mitochondria to increase protein production and metabolic rates. So all of these things together are working at a a different area and enhancing the quality of the hair you have. So let's shift gears a little bit. So let's talk about lifestyle choices. Now, in reality, there's probably not a lot of difference you're going to make on something genetic like male pattern loss, but certainly if you lead a high stressful life and your stress hormones are high, you want to make sure that you're taking care of those. Proper exercise. I will mention diet. Diet can have a major impact on your hair, or if you have metabolic things going on like low vitamin D or thyroid issues. Not quite as common as male pattern loss, but certainly you want to make sure that all these things are addressed in your life. So we started off this conversation with talking about a receding hairline. Unfortunately, none of the medications I just talked about will actually move a hairline. It's not going to lower it from here to here. What can you do about that? Well, I have a great solution for you, a hair restoration procedure. And what we do with that is actually take hair from where you do have it, remove those hairs through a process called follicular unit excision, and move those to another area. And specifically in your case, if you're suffering from a receding hairline, lower your hairline with it. So I'll say in summary, if you have or you notice a receding hairline, that's a sign that you might have male pattern loss. Seek out some advice from a medical professional who deals with hair loss. They'll make a diagnosis to make sure that's what's going on. Then they're going to make some recommendations about the treatments. So medical treatments such as Finasteride, Minoxidil, PRP, and Photobiomodulation are all options for you. Medical treatments are a great option to keep the hairline where it's at currently, but if you want it lowered or you want it moved or bring out the recessions, a hair restoration procedure is the only option for you. I mentioned earlier you can battle your hair loss issues with Finasteride. Watch this video to see how it can help you.